Good evening, respected dignitaries and the delegates. I'm a nurse and midwife by profession, so my concentration will be on that subject. Concepts like the sides of the coins. One cannot exist without the other. Nurses and midwives, the largest proportion of health professionals, offer critical contributions to the national, international health, and MDG goals through direct care and 24-hour service coverage in all health settings across the continuum of care. We are all aware about it. WHO bulletin has stated that 24 million nurses are required in India. Increasing the numbers of nurses and midwives alone is not sufficient. Improving capacities, nursing services, and healthcare delivery require concentrated strategic interventions to improve the quality of nursing and midwifery education. Nursing education, it is a very demanding task and situation in present-day time. It is multidimensional and multifactorial, complex and complicated, very difficult to decide where to begin. To start with the curriculum, ideally it should be based on societal needs and it should imbibe critical thinking in students. But is it the best for nursing and midwifery? The teaching methodology that is used in nursing, they have theory in classroom, lab procedures, and then actual patient care. So we have to think which is the best teaching methodology. And then the method of evaluation, the most suitable for the classroom, clinical, and community. Maybe evidence-based research and results are needed because there is not much research in nursing education. There is need for pedagogical research, and the research should be on large samples, multiple settings, and lots of replication to have evidence-based results. In Andhra Pradesh alone, there are increasing number of institutions and the number of seats. Multipurpose health worker schools are 301, schools of nursing for GNM programs around 400, colleges of nursing for BSc nursing programs 216, plus 13 post-basic programs and 25 MSc nursing programs. Here is the graph that shows the difference between government institutions and the private under government. Almost all are less than 20. Facilities for nursing educations are needed in various ways. There should be proper infrastructure. Teaching faculty is the major problem because a nursing teacher, she should be an expert nurse herself. Nursing is something like swimming or music, where the teacher has to be an expert musician. But this is not so. Opportunity to practice is variable. Somewhere it is nil, very less it is optimum. There are nurses who have graduated who have not conducted even a single delivery. There is a problem of gender also in India because India is a male-dominated country and most of the nurses are women. There is also medical domination in most of the hospitals and healthcare settings. While preparing the students, there should be a collaborative relationship concentrating on personality development, self-confidence, assertive skills, etc. There are lots of new drugs. There are look-alike and sound-alike drugs, creating safety of the patient's problems. There are new treatments and procedures, scopic and micro-robotic surgeries, which requires nurses to be adequately prepared. But we see lots of machines are there and very little touch is there. In most of the ICUs, I see nurses watching the monitors but not observing the patients. Now, nurses need to be accountable. When the nurses are empowered, they will be accountable. And we don't see much in our present scenario. Just as nursing practice is being challenged to measure patient outcomes, nursing education is being challenged to develop student outcomes. The quality of educational programs to be judged by student competencies. That is what the students can actually do as a result of education. And the previous speaker also stressed on hands-on education and practice. We are all aware that there are new diseases, new pandemics, less communicable diseases, more non-communicable diseases, increased life expectancy is there, so need for preparation in geriatric care and chronic disease management, hospice care. There is also impact of globalization. Nations without boundaries, we talk about that. There are international patients, foreign languages, diversity of culture, and concept of global village. This is an era of telecommunication and satellite linkages. So can we deliver nursing courses via telecommunication and satellite linkages to increase the access for students living in remote areas? The present situation is something like seesaw. There are shortages of nurses, no job vacancies, delay in filling up of vacancies, problems related with recruitment and retention. Even though so many nursing educational institutions are there, problem with bond period, salaries, and incentives. There are various accreditation bodies to control. State governments are there, state nursing councils are there, state universities are there, and then we have this big brother Indian Nursing Council. But still, we don't get the quality because various factors are there like this. To conclude, I would say nursing education should be such to prepare nurses capable of meeting consumer demands on one side with self-satisfaction and self-esteem. Thank you very much.